This is Fido Friendly Travel Talk. Here's your host, Susan Sims.
Hey everybody, it's Susan Sims with Fido Friendly Travel Talk, brought to you by Animal Radio, where we talk about the travel and lifestyle for you and your furry best friend. And I know as pet parents, we love our furry companions, and if there's anything at all we can do to help make their short time with us comfortable and pain-free, we're going to be on it. You're going to enjoy listening to my guest today, Dr. Bob Menardi. He's Chief Veterinary Officer with Exubrion Therapeutics. Hi, Dr. Bob. Welcome to the show.
Hi, Susan.
Hey, I'm so excited to share this information with our listeners. You and I chatted just a tiny bit about it. So first of all, let's just jump in and tell us a little bit about your role with Exubrion Therapeutics and how the company is focused on relieving animal arthritis pain with an injection.
Right. Well, I got interested in Exubrion Therapeutics really because of an interest in pain management. When I learned about what Exubrion was doing with a product called Synovetin OA that treats really arthritis pain at its source and can provide a year's worth of relief with a single injection, well, I was hooked. This was something that was very novel and very unique, and the technology that it's built on is very exciting.
It sounds like it. And also, I just occurred to me, how new is this?
Synovetin's been around for about 3 or 4 years, but it's really experiencing some good growth. One of the things that we're trying to do is to really raise awareness of this very novel type of treatment for pain. When you think about pain is the one thing as a veterinarian that it's obvious that it can have the most dramatic effect on the quality of life of an animal. Mm-hmm. We have been we've had some traditional good pain therapies for a long time, but this one is truly unique and truly novel and approaches pain from a completely different direction than most of them do.
So speaking of that, what are the current methods? Like if I was going to the vet 3 years or 4 years ago, and we discovered that my dear little honey had this problem with pain or arthritis. What's the normal protocol before we had the Synovetin?
Right. So I think it's important to remember that osteoarthritis is really a disease of inflammation. And inflammation does a couple of things. It not only hurts, but it also damages the joint. Most current medications out there, the most common medications that are being used are analgesics, like the aspirin or the ibuprofen that you and I would take if we were painful. Those can be very effective, and we've got some really good tools as veterinarians. Mm-hmm. But they're really good pain relievers. They sometimes don't do as good a job as addressing the inflammation in the joint, and the inflammation is what causes most of the problems.
Mm-hmm. Mm-hmm. So tell us how this is going to work. We take our pet in, they decide this is what we're going to do. You had said that I think the injection can last a year, but let's kind of walk us through. We come in and what do we expect before we get the injection?
Right. So again, Synovetin OA is designed to address that inflammation at the source, and that's really what we're targeting. So when you bring your painful dog in, the first thing that the veterinarian is going to do is do a good evaluation, make sure that he's got a good diagnosis, and then he's going to talk to you about this simple treatment, which is a single injection that will give you up to a year's of benefit from it. The thing that's different about Synovetin than the others is that it works directly in the joint. It does not have to be distributed throughout the body to do its job. It's injected into the joint. It does its job right there at the source of the problem, which is the inflammation itself.
Does it work quickly? I mean, how soon would we notice our pet feeling better, moving around better? I've seen some case studies on your site, but for our listeners, what would we expect?
We see a positive response in most dogs within just a few short weeks. So after the injection, within about 2, 3, 4 weeks, you start seeing improvement. But the really fascinating thing is we tend to see increasing improvement over the course of the next several months. So the first benefit you'll find at 2 or 3 weeks. After that, you'll get continued improvement through several months out to a year. And many dogs go even beyond that.
Wow, that's amazing. Cross pause. We are not there yet. Honey's 9 and she's had other issues. Let me ask you real quickly. She was diagnosed with IVDD, I think it is, invertible disc disease. Mm-hmm. Would that work on that?
That's another painful disease. And unfortunately, Synovetin is really designed for osteoarthritis. The joints in the spine are different than the joints in the legs and in the limbs. And Synovetin really works best in the type of joint that's present in the shoulders and the knees and the ankles and some of these other synovial joints where it's not as effective for intervertebral disc disease.
Darn. Well, we've really gone through. Luckily, I found a really wonderful pet rehab place where they did laser acupuncture, and I've got all the red light that probably is out there, but not to get off subject. But realizing our pets, they all have a different road to wellness. Is it possible that an injection would be needed in the middle of that year? Ideally, it's a year. And would they just get an injection every year, or would they get more than one?
Most dogs do well for a year. For some of the more severely affected dogs, you may see some signs of discomfort a little bit before that. Other dogs go well beyond that. I think it's what I always tell people is to let the dog tell you when it needs another injection. When you start to see that dog slowing down a little bit, having difficulty getting up and walking, that's the time to think about another injection. In most cases, it's going to be a year beyond that first injection.
Now, this is probably a silly question, but it's not really just for the geriatric, right? It could happen just like with people. It could happen at a younger age. So we would really just have to, keep an eye on our pets, which we probably do anyway.
That's exactly right. Osteoarthritis is not an old dog disease. One of the things that we see very commonly in veterinary medicine are problems with the joints not growing correctly, and it will set the stage for arthritis at a very early age. So they'll get these inflamed joints as fairly young dogs. And the problem with that is that inflammation starts then, and that dog is really resigned to a lifetime of discomfort. If we can get rid of that inflammation up front, we have the best chance of being able to preserve the health of that joint for the entire life of that dog.
That's awesome. So is this readily available? If I were to go to my local veterinarian office and say, look, Synovetin, that's what I'm here for, and we're not leaving until we get it.
There are about 100 veterinary clinics across the country that carry Synovetin. It is a special type of therapy. It takes a little bit of special training and some commitment to some special processes and procedures. And because of that, it's not available at every veterinarian, but it is available at almost every state in the country. And there are 100 clinics right now, and that number is growing all the time.
That's wonderful. So before I let you go, anything else you'd like our listeners to know? And most importantly, what is the best place for them to learn more about Synovetin?
I think the most important thing for people to remember is that if you don't address the inflammation, then you are not treating arthritis. And I think that Synovetin is a great choice to really attack the inflammation at its source. You can find out more about Synovetin at activedognow.com. There's a great amount of information on there. It has a map where you can look up Synovetin treatment centers in your area. This is just a terrific place to get a lot of information.
That's wonderful. Thanks so much for taking the time to talk with me today.
You're very welcome, Susan.
That's it for Fido Friendly Travel Talk. You have been listening to my guest, Dr. Bob Menardi, Chief Veterinary Officer with Exubrion Therapeutics. For more information about today's show or just about traveling with Fido, log on to fidofriendly.com. Until next time, travel safe and leave no dog behind. This is Susan Sims with Fido Friendly Travel Talk.